module 2. Can you just give me a thumbs up if you see it? Okay, perfect. I'm never sure exactly what you guys see on your end as I'm doing this. So I want to welcome you guys, and I appreciate the fact that you guys are here to, learn about, patient success as well as your own success. So like Patrick said last time, we talked about, how to define your own success, because this will become something that really is intrinsic about you and you evaluating yourself. And that's part of what we're going to lead into in today's topic. So, we all became therapists in order to help individuals get back to doing things that they wanted to do and they can't currently do. And so, they're coming to us because they can't do those items and they want to get back to doing it. So how do we make sure that they are successful so that we're successful is today's topic. Okay, so there's a lot of research out there on patient adherence, and you might have seen this in your schooling system, and maybe you haven't, I'm not sure. But there's a lot of information out there that says approximately 20% of our patients will drop out of treatment within the first 3 visits, you guys. That's 3 visits. And 70% will fail to complete, thank you for the shocked voice, and 70% will fail to complete their full course of care. So here's my question. How can we possibly get somebody better if they don't come to physical therapy, right? So that's really what you guys should all be asking yourselves as well. And why do so many people stop coming to physical therapy? So I want you guys to think about a situation that you've been in. You can think about it in a healthcare situation. You can think about it in any other situation that you've been in. But, some situation where somebody gave you a piece of advice and you went out and sought that piece of advice from them. They gave you that advice. And then whether or not you took their advice and you carried through with it, right? And a lot of times, there's times where we did not follow through with their advice. But why? Why didn't you follow through with their advice? You went and you asked for that advice. For instance, like if you go to the eye doctor because you're having a difficult time seeing. Now, if they tell you that you need glasses, most of us are going to go ahead and get those glasses, right? But sometimes some people don't. They choose not to go get those glasses. So you have to think like, what made that individual go seek that advice and then decide not to follow through with it? And the answer is there's lots of reasons, right? When it comes to physical therapy. And in particular, in PT, they've done a lot of research on this. And I alluded to this last time, but a lot of the research shows that individuals need to have certain items sufficed or checked off the box in order for you to get the buy-in that's needed for them to come to PT. So that's what we're going to talk about today. And it all starts with the clinical evaluation and communication. And in all honesty, it actually starts well before that. It starts the first time they call in to our office to get scheduled, and or we call them because we received their prescriptions. So most of you guys aren't going to see that side of it because we're a large organization. We have a phenomenal way of getting those patients on the books. But if you're in a smaller organization, you might see this a little bit more. But just understanding what it is also really important. But your first conversation with patients, right? You're having a communication pathway, and that communication pathway is really important in order for that patient to decide, yes, I want to come to physical therapy, or no, I don't want to come to physical therapy. Or maybe even I want to go to physical therapy, but I don't want to go to this physical therapist, right? All those scenarios, they do happen. In school, you spend a lot of time talking about the evaluation process as far as the tests and the measures and making sure you get those done right. And hopefully you guys spend some time on communication. I don't know, for those who have, their video on, does anybody still take a communication class in school? Raise your hands, anybody? Okay. So, we took a communication class. And as a matter of fact, we had to do a scenario where we had to video ourselves in a difficult conversation with somebody. that was not excited about the treatment plan that we did. And then we got graded on our communication skills. So if you haven't learned about communication, it's really, really an important piece of what it is that we do. We can explain what we do. If we explain what we do well, patients will buy into what it is that we're doing. But if we don't explain to them in a manner that the patient can understand, right, and synthesize that information and digest it and really truly understand it, then the likelihood of them continuing through to the end of PT gets lower and lower. Okay. So in communication, say I'm the physical therapist, and let's say Starla is the patient. So I am speaking to Starla now, and I'm telling her about what's going on. So I'm the sender of the communication piece. And the message is what it is that I want to tell her. Let's just say it's that her knee range of motion needs to improve in order for her to be able to walk down the stairs. Okay. Now, Starla is going to receive that information. Okay. Whether or not she understands it is a different question. Okay. So what I'm saying to her, I'm saying, Starla, you need to be able to have 110 degrees of knee flexion in order to be able to walk down the stairs. Now, she might give me some feedback, and some of that feedback is, I don't know what flexion is, and I don't know what 110 degrees is, right? So I didn't send that message in a way that the receiver could truly understand what it is that I'm trying to get across. What a better way I might say it is, we need your knee to bend more and be more flexible in order for you to have the mobility to walk down the stairs without having to hold on to the handrail. Isn't that one of your goals? That's one of your goals, right? And so if I get that confirmation piece as well, right? I said, right, then she has the opportunity to give me feedback by saying yes, no, and or we all know, that nonverbal communication is one of the higher pieces of communication. So she might be shaking her head that she agrees, like Patrick was doing just a second ago, and or she might give me this puzzled look like, that's not what I said to you at all. I don't want to be able to go down the stairs. I want to be able to go up the stairs, right? Something along those lines. So the communication pathway is really important for our entire evaluation. And if you guys haven't taken any communication classes, I highly recommend you try to really evaluate your communication skills. And there's many ways to do that. But making sure while you're in the clinic, just simply asking if the patient understands or has any questions about what it is that you're communicating about is a great way to start that process of getting the feedback to know whether or not you are giving the message or they're receiving the message the way you want to give it. So I found this little, I don't know if it's called a cartoon or what, drawing, we'll call it a drawing. And I thought this was great because perspective is everything, right? And I'm sure there's tons of different posters that show this and everything, but one person sees a 9 from their vantage point and another person sees a 6 from their vantage point. And really, this is the way that the world works, right? When you're in some sort of situation where you're communicating with somebody, you understand what it is that you're trying to say, but the person may not understand what it is that you're trying to say. And the person understands what they're trying to say, but maybe they, that it's back and forth is what I'm saying. And there's also perspective, right? Meaning that, you as the clinician have a unique perspective that you understand what you're supposed to be getting out of today, the very first day that somebody walks through the door. But the patient also has a perspective of things that they want to get out of the first day of coming to physical therapy. And making sure that you're in alignment is crucial to making sure that patients get the buy-in to come to PT, okay? So from a clinician's perspective, right, that what we're trying to do is an evaluation or an examination to discover what we think of as a physical therapy diagnosis. What's going on with this individual? So in Starla's case, does she have a meniscus tear? Is that what's stopping her from being able to bend her knee enough to go down the stairs? Or does she have patellofemoral joint pain? I'm trying to use my tools that I've learned in school to be able to decide which one it is, because I'm going to treat them differently. The patient doesn't know that. They just want to know, can you fix my pain, right? So we're going to trial a hypothesis on that first day to help the patient get better based upon these objective measures that we took. But from the patient's perspective, they want to know, can my symptoms get solved? Starla's going to want to know. All they really want to know is, are you going to be able to help me walk down the stairs better? So did you answer that question? It's not really about what it is that, like your perspective. Did you answer the patient's perspective on that first day? And if you haven't thought about that before, I would really challenge you guys to start putting yourselves in the patient's shoes to think about what they're thinking about on that first day. And did you answer what the questions they could potentially have? Do you even ask them, like, what are their goals for physical therapy? Because the obvious is that most of us don't want to be in pain, and most people come here because they're in pain. So that's an obvious goal. But there's a lot more to it than, than just that. Maybe they recognize that they're not going to be pain-free, but they just want to be able to reach to put their clothes away on the hangers, on the top shelf. They're going to base their decision on continuing physical therapy on the communication and the answers that they received on that very first day. And if you guys remember the conversation we had last time, the factors that help patients decide whether or not they want to come to physical therapy, there's time, money, right? And do they truly believe that you're going to be able to help them? Okay. Any questions so far? Good. Okay. So again, what makes a successful evaluation? We've talked about perspective at this point, but also, how do you know what patients might be looking for, right? So patients really are looking for individuals who are good listeners to their problems, okay? So they're coming with an issue and they want somebody to be able to sit there and listen to their issue. Now, I'll also say that you can't just let individuals talk about their issue for 2 hours. You might need to politely move them along, right? So we have lots of people who say, well, this is 2024. In 1980, I had this happen. Starla's laughing because she knows, right? And so I had this happen this morning and I was like, okay, that's great. But what has been happening recently to get you to come into physical therapy? Because this has been a chronic issue. Oh, okay. Well, let me get started there. So you might need to politely move them along, but they want to know that they've been heard. Okay. They also want to know that there's some decisions, a pathway, right? Can there be some tests and measures that help with the physical therapy diagnosis? So if you can't reproduce somebody's pain, it's not necessarily that, they're not appropriate to physical therapy, but our hair should stand up on our skin saying, why can't I reproduce this individual's pain? Is this something that they should be coming to PT for, or is there something else that should be happening? We should be able to bring on their symptoms so that we can tell them that we have a resolution to their symptoms, right? And that helps them to understand that you know what they're going through and that you have a way to get them out of it, okay? So we want to be using our tests and measures appropriately so that we can make sure that we've got a pathway for their success. For instance, there's you can measure the range of motion and the strength of somebody's arm and shoulder. And then you can let them know, well, I think that your shoulder's hurting because your rotator cuff is irritated, versus that this might be coming from your neck, right? Because they come in and maybe they're like, oh, I think it's, my neck. And you can say, well, actually, I think it's really coming from your shoulder because when I do these measurements, your range of motion loss is related to, XYZ, a capsular pattern, which is related to frozen shoulder, for instance, or, you have some weakness in your rotator cuff. And your rotator cuff is a group of muscles that most people have heard of, but it really, you don't know what they do. They help raise your arm up so that you can do the activities that you aren't able to do right now. So have you gone it a step further? Like, you know that they've got a rotator cuff issue, but have you explained it to them that's appropriate in a physical therapy diagnosis? We also need to make sure that we stay within our practice guidelines of what is appropriate for us to be discussing with them and what's not. The big thing that patients want to know after they've been heard, right, is that there is a fix, right? You are going to be able to help them solve their issue, okay? So I can't even tell you personally how many times I've left a doctor's office or a dental office or whatever, and it's like, I really still don't have a great understanding of what's going on and how they're going to help me. A personal example is last year, I bit into something and I had this sharp pain in my tooth. And so I went to the dentist, and then, it didn't get better. So I went back to the dentist, and he's like, well, I don't think you have a crack in your tooth, but the only thing we can do is a crown. And I'm like, well, but wait a minute, like, why are we going to do a crown? And then I might still have my pain. You don't have any evidence that a crown is going to help me, right? So I went on and I went to see an endodontist to make sure that that was the right treatment pathway for me. It turns out I didn't have a crack in my tooth. I just had a sensitivity there, and I was able to get that to go away with a different treatment pathway. Okay. So I chose to go get a second opinion because what they were saying to me didn't add up to me. Does that make sense to everyone? Right? We want to be following and showing them that we're going to be able to help them. And then we want to give them expectations. Okay. So I expect that you'll be in physical therapy for a total of 6 to 8 weeks. I expect that you should be starting to feel better in 1 to 2 weeks or 3 to 4 months, right? With frozen shoulder, it could be a longer period of time. Are you giving them some sort of expectation to understand what the physical therapy journey is like? Okay. Because a lot of people come and they think that they're going to only come one time, right? So when we go to our doctor's offices, we see doctors. I see my eye doctor once a year. I see my dentist twice a year, right? We know those regular rhythms. So if you go to a physician to see what's going on with your shoulder, those individuals may or may not have a follow-up. They have to be instructed as to whether or not there needs to be follow-up. A lot of people haven't come to physical therapy before to understand that we may not see them for a long period of time, right? For years and years and years, but we see them quite frequently for a short period of time. It's a much different treatment guideline than, a lot of the other healthcare individuals that they have seen before. All right. I am sure that we all feel this way, right? But like, say, when I had my toothache, right? I wanted to feel better fast. Okay. Like, you don't want to feel better in 6 months from now. We want to know that what it is that we're doing is helping. So we want to feel better fast. So from the perspective, again, the patients are thinking that you're going to be able to do something to fix their symptoms immediately. So sometimes if we're magical, we can do that. But most of the time in physical therapy, it's a process. It's going to take some time. We understand the physiology behind that time, but the patients don't, right? We know it takes 6 weeks to make strength gains in hypertrophy muscle. The patients don't know that stuff. So we need to teach them, well, we want you to start feeling better within XYZ timeframe, but to get completely better, it's going to take a longer period of time, whatever that is. Okay. Okay. So a great example of this could be, most of us have had this happen where a 15-year-old comes in on let's say Wednesday, they hurt themselves in practice on Tuesday, right? They sprained their ankle, and they have the tournament of a lifetime on Saturday, and they have to play in Saturday's game, right? Now, there's going to be some times where that might be okay, and other times where there's no way that's happening, or that's intelligent to tell them that it's okay to do that, right? And again, you're based upon the objective information that you're gaining in your evaluation. But I'm telling you, the patients don't understand this, right? They don't understand that you can't just tape them up and then they can run and play on Saturday. Or how fast can you get me better? Because, you know, the colleges are coming to look at me. And so I need to be able to do X, Y, Z. I mean, I had this happen with my daughter this last year in dance, right? She hurt herself, and I told her, I was like, you have a competition this Saturday. You are not doing the things that you need to be doing in the competition. She was very upset at me, but I was like, that is what it is, right? So obviously, we're going to tell our patients in a much kinder way, and we are going to show them the hope and the pathway and how to get there. But if they understand that it could put them in more harm's way, they're more willing to, you know, listen to you so that they can follow the pathway for success. Okay. Okay, I wanted to show you guys some examples here, just in case you don't believe me that this happens, okay? And that this is truly what the patients are feeling. So hopefully you guys can see this. I tried to make them big, but not take up too many slides, so I didn't put them on separate slides. But we send out a survey on, I think it's after the first and after the third visits, or somewhere very early on in physical therapy. And there's two different surveys, but basically they're asking about their experience and whether or not they feel like physical therapy is helping. And these are important surveys for many reasons, but one of them is for us to get feedback when patients don't feel like they're moving in the trajectory that they think they should be. And sometimes, you know, they just don't understand where they should be, or in other times, they're valid concerns that they may or might not have. So this is one of the things that one of the patients said in the survey. The therapy sessions are completed now. So she's all done, or he's all done with PT at this point. The physical activity was probably good for me overall. Don't feel any improvement in the occasional shoulder pain that brought me to your clinic. I think it may have been a more productive experience if we had established specific goals in that brought me into your clinic at the beginning and reflected on any progress. Okay, so this is an unprompted feedback from a patient. So what they're saying is that they were wishing on day one they set up some goals, and that as treatments go on, that they looked at those goals to see whether or not the progress was being made. Okay. And then on this other one, it says more information on what they do, how it helps. Okay. So again, if you guys don't believe me that this is truly what patients are thinking in their head, this should be some evidence that this is what patients are wanting. Okay. So again, a successful evaluation, what is it going to entail? I know this seems like I'm harping on this, but this is really an important setup for the success in the patient in the long term. But you should be trying to figure out the PT working diagnosis and hypothesis. And for the patient, you want to define their immediate future, okay? The frequency of physical therapy, the duration of physical therapy, and the expectation for improvement. Okay, so I just saw somebody yesterday and their symptoms were very severe. And so I told them I wanted them to be starting to feel improvement within about 4 sessions for the issue that they have. And if they don't start feeling some sort of improvement, or they're starting to feel worse, I wanted them to go back to their doctor because they hadn't had any imaging yet. And they had a radiculopathy with a lot of weakness. Okay. And so I gave them clear definitions for what it is that I wanted them to be having. I also told them that, you know, if they're starting to feel any sort of improvement, I was happy with that. And let's continue on with physical therapy. No matter what, they're going to continue with PT, even if they go back to their doctor to get some more imaging or not. Okay. But define the communication during therapy, right? Especially if the PT is not meeting if physical therapy is not meeting the milestones. So for the patient who had an ankle sprain and they are that 15-year-old and they want to get back to soccer, and we kind of expect them to get back to soccer in about 6 weeks, right? If they're on week 5 and they're still limping, right, we've got to start to answer, why are they not progressing the way that we think they should be progressing, or the way that we know that a normal progression is happening, right? So we need to start being able to have that communication. That shouldn't really happen with an ankle sprain in most times, but maybe they're not doing any of their stuff at home, or maybe they're out running and cutting and they're just continually aggravating their ankle, and not telling us, right? So are we having that communication with them? And then follow through with the plans by being able to walk patients up to the front desk. Okay, so one of the most critical things, I can't even stress this enough. So say Patrick is my patient, okay? And I told Patrick, you have, your rotator cuff is a little bit irritated. I see that, we've got to work on your mobility in your shoulder before we can work on your strength in your shoulder. I think in totality, you're going to be here for about 8 weeks. And then, at about 6 weeks, you probably should be able to get back to tennis, which is what brought you here in the first place. And then we can see how you transition back. Okay. Let me walk you up to the front desk and let me back up. And then I say to Patrick, does that sound good? And Patrick is like, oh yeah, that sounds great, right? Awesome. Okay. And then Patrick walks out to the front because I've got another patient. And then later on, I look and I see Patrick didn't schedule another appointment, right? And then I go up to the front desk and I'm like, why didn't Patrick schedule another appointment? I had no idea that he was so excited about coming to physical therapy when I talked to him. This happens, so you guys have to seal the deal, okay? So I can't stress enough to you that somebody in front of you is going to agree with you, everything you say, and then by the time they leave you and they walk up to the front desk, the thoughts that are going through their head are, how much is this going to cost me? How much time do I have the time to get off of work? Can I not be on my tennis team for the next 6 weeks because they're really counting on me to win the championship? All of those thoughts are going through their head before they have the time to walk up to the front desk. And you're confident you're going to get them there, but something has happened where they're not so confident. So walk them up to the front desk and tell the front desk, let's say that's Starla, say, Starla, Patrick is here. He's going to go ahead and schedule out twice a week. I want him to come twice a week for the next 6 weeks. Any questions, Patrick? Patrick says no. And then Starla's right there to schedule him out. That's a recipe for success. Now, it can't always happen, and that's fine. But if you have the opportunity to do that, it's a very nice transition to be able to do that, to make sure that that patient gets scheduled. All right, so that was day 1. All right, we made it through day 1. Whew. All right, so what do you do day 2 and beyond? One of the things that I see that happens to a lot of clinicians at the beginning of their careers, and then again, after a few years of treating, is we just sort of treat in front of us, right? We don't, again, continue to think about what is our plan that we first told our patients on day 1. Patrick, I told Patrick that he's going to be here for 6 to 8 weeks, okay? And we might be 5 weeks in, and have we progressed his plan of care at all, right? Are we getting him back to being able to serve in tennis, which was the thing he couldn't do, right? Because I told him around 6 weeks, we were going to try to start to get back into tennis if it was appropriate, okay? So one of the things I want to stress to you guys as well is to make sure that you're thinking about this as the treatment weeks go on. Okay, so you're not just doing it on day 1 and then never thinking about it again in the future. Are you having conversations with the patients to make sure they're progressing as you expect them to? Or if they're not, are you backing up and understanding what's going on to be able to redirect them to get them where they need to be? Are they redefining their goals to progress as needed? Or maybe, we need to relook at something. Maybe we did miss something. Maybe it's not their shoulder. Maybe it is their neck. Maybe it's a cervical radiculopathy that tricked us on the first day and we thought it was their shoulder, but it's not. It's their neck. So maybe we need to start adding neck exercises into the mix that we weren't doing before. And you can do that before a progress note, but it's also a really good idea to utilize that information in those conversations with your patients on follow-up to decide when you need to do the progress note. Okay, there's some insurances that might dictate when you need to do those progress notes, like work comp, for instance, and Medicare. But for other insurances, it might be related to when their authorization ends and or when your plan of care expires or other items. When they're going back to the doctor, I always feel like if they're post-op and they're going back to the doctor, it's a great time to do their progress note so they can take it to the doctor and say how amazing they're doing. It's also a great marketing tool to do. Like, look at, I've had 20 degrees of knee flexion at the beginning of therapy, and now I have 120 degrees of knee flexion in 4 weeks. Look at how amazing these physical therapists are, and they helped me get there. So at some point in time, you should want to do a progress note or a reevaluation. Now, if you're a PTA and you're treating the patients on a regular basis, you can also help the clinicians understand when they need to do progress notes and reevaluations and have that communication with the PTs about making sure that those patients have those. Maybe even if they're on your schedule, the PT walks over and does it, and or getting it back on the PT schedule, which is the obvious preferred way to do it, so that that patient can have that progress note. So just like on day one, there was perspective differences between the clinician and the patient about a progress note. There's that same perspective differences between clinician and patient for progress notes, okay? So as clinicians, a PTA, CODA, sorry, I should have included OTs in here, and PTs, like, we know what a progress note is supposed to be doing for us, okay? But a patient, if they've never been through PT before, has no idea what a progress note or a reevaluation is or the purpose of it, okay? So it's an education piece that you can use to discuss with them, the progress that they've made in physical therapy by measuring your range of motion, your strength, your special testing that was positive before but is not positive now, hopefully. So you can show them the progress they've made. The other thing that happens sometimes is patients don't see the progress they've made. Oh, I still feel the same, right? But you do their progress note and you quickly realize that they've got, they've gained 90 degrees of shoulder flexion range of motion. This happens a lot for like rotator cuff repairs, right? Oh, I'm still in a lot of pain and they're like 8 weeks out. Well, yeah, they're still in some discomfort, right? They're not back to normal yet. But, you're now sleeping at night. You can now get dressed by yourself. You can take a shower. You can wash your hair. Reminding patients the distance they've come thus far is a good buy-in for patients to be able to continue physical therapy. Okay. It also allows you the opportunity to show what you still haven't done, right? So we've made about 50% of your goals, but we haven't gotten 100% of your goals. So you need to still keep coming to physical therapy, because a lot of times when drop-off happens, if it's not within those first 3 visits, right, it's right after the progress note, because we haven't done our job to tell and get the patient to understand why they need to still keep coming to physical therapy, okay? So again, the progress notes and the reevaluations, think of them as another opportunity for you to showcase the fact that they've improved, but that they still have improvements to make. Any questions so far? So again, just comparing objective measures for progress, explaining what those measures mean to the patient. Like, patients don't understand our manual muscle test grades. They would have no clue what a 3 versus a 4 is, right? So if we tell them, oh, you're doing so much better, your external rotation strength now is a 4 out of 5, they like have no idea what that means. So what does that mean? Well, your strength is getting better in your shoulder. I can see that when I push on your arm, and then that allows you to be able to put 5 pieces of clothing away in the closet instead of you having to do it 1 piece at a time. Okay. Continue, but you have to tell them again, they're not the experts, we're the experts. So we have to tell them how much longer we expect them to take in physical therapy. Okay. So just like think about it like this, you guys. When you go to a restaurant to eat, okay, and you go up to the host or a hostess table and you put your name in, right, for a table, right? And they tell you, you see so many people around, you're like, oh my God, how long is this going to take for me to get seated, right? And they're like, it's going to take like 30 minutes. Okay, fine. I'm willing to wait 30 minutes, right? But everybody's looking at their watch. Don't tell me you haven't done this at 25 minutes, right? And you're starting to think, okay, they should be calling me soon. They should be calling me soon. And then, I'll just say I do this. But if it's like 35 minutes, I'm up at the front again and I'm like, okay, well, it's been 30 minutes now. So like, how much longer do we think this is going to be? It might be a silly example, but patients feel like, okay, you told me this is how long to expect in physical therapy. Now we're reaching that time frame. Am I going to need to keep coming to physical therapy or not? Right. So unless you tell them what to expect, they're not going to know what to expect. So I saw somebody recently who had ACL surgery, and that individual thought they were cleared to return to sport after 3 months. They were like, went back to the doctor to go back to their sport, which is a cutting sport. And the doctor obviously told them, no, you need to go back to physical therapy. But I'm just going to tell you that PT that they saw, which was not our company, failed them, right? They didn't tell that patient, like, you can't go back to cutting until you're at around 5 months. Like your expectation to start running is at 3 months. Then you're going to cut at like 5 months. Then you're going to, maybe start contact after the doctor has cleared you, of course, like 6 months and beyond, depending on how you're doing, right? But the original physical therapist discharged that patient after 3 months. So you really want to be, and the patient didn't have a clue, right? So the patient just thought they were ready to go. They were going back to the doctor to get cleared, but the doctor was like, no, no way, right? So also, if the patient goes back and has that experience, if I were the doctor, I'd be like, what therapist did you see that said that to go back to the doctor, to my office, to get cleared for sports after 3 months, right? So again, your communication with your patients, it doesn't just stay between you and your patients, right? Those patients are going back to the doctors and communicating with them about the conversations you've had as well. Okay. Then after the progress note, I cannot stress it enough. You need to make sure that they schedule more visits, just like on the very first day. Okay. So they may be in agreement with you in front of you, but again, they're starting to have different thoughts and conversations in their head by the time they get up to the front desk. Okay. So it's finally come. You've done their evaluation. You've made a good impression. You know that you can get them better, and they believe in you to get them better. Okay. You've treated them along the way, right? Your PTA, good team, right? The tech, everybody's a good team. Or OT and CODA, right? Everybody's a good team, got their hand working again. They can handwrite. So at a certain point, we need to decide that the patient is doing really well and they're starting to be ready for discharge. So hopefully you guys don't decide that the day of discharge. Hopefully that's a conversation that happens maybe 1 or 2 visits prior to. I wouldn't have it too much further than that ahead of time, because the patient will decide to discharge themselves. Okay. So, and then you'll never see them and they'll ghost you. Okay. So, but you're starting to get them ready for that very last day in physical therapy. And on that day, again, you want to test their range of motion, their strength. You want to give them advice for the future, because probably the chances are at some point they're going to need your services again. Okay. And when they do, you want them to think about you and how well you treated them during their last episode of care that they needed. You got them back to all the goals that they wanted to get to. And they're going to only think of spine and sport to be able to help them with their next injury. And even more so, if they've had a good experience and they have gotten back to where you guys discussed it was a reasonable position for them to get back into, they are going to go shout praises to you all over the world. Okay. So they will tell everybody, their friends and family, about how wonderful it is that I can now move my arm again. It was such a long journey, but now I can do it. And I'm back playing tennis after my rotator cuff repair. And I'm telling you, they go up to strangers in Lowe's when they see that sling. People will go up to strangers and they'll be like, did you have a rotator cuff repair? I had a rotator cuff repair. I did physical therapy and it was great. Oh, where did you do physical therapy is the next question that person wearing the sling is going to ask, right? So all of these things make a huge difference for you in building your community of individuals who want to see you as well in honing your craft. So I think the last thing to think about when we talk about the patient, the full circle patient, right, is that don't get bogged down in your own head thinking about all of these things, getting it down, tests and measures, just putting it in there and not putting the pieces of the puzzle together and communicating it to the patient. One of the most important things is to communicate with the patient in a manner that, of course, is appropriate, right? And making sure that we're optimistic about how things are going. And we have those good communication skills with our patients to be able to lead them to success, because they really, truly this is a hard time in their life and they want to know that there's hope for them, right? And so if there's not that communication, if there's a lapse in communication, then the patients can fill in that lapse with anything that gets into their head. Okay. So we want to make sure that the communication that we're giving is appropriate, and also asking for that feedback, that to know that, that they truly understand what it is that we're saying. And if not, you can reiterate it in a different way. And especially if you're struggling with certain diagnoses or patients, right? Personality types, right? Different things that you can then turn to either your CI, or when you're first out in the clinic, you can turn to your mentors to ask them for advice as to how to go about this in a little bit different way. Because communication is probably one of the most important skills that we have as therapists and clinicians in being successful. And with that, that is today. So next time, we are talking about, I think, KPIs. So, which is key performance indicators. So that might not mean much to you guys at this point in time, but it's an important part of really any business. And I hope that you guys can join me to learn about those, because it really is something that if you lean in and understand them, then you can utilize those pieces, that piece of data, to understand how effective you are as a clinician, as well as your power and growth over the first few years being a clinician, and then understanding where you need to go and take Con Ed courses and what skills you need to hone in on. And all of that can come from just understanding the KPIs, right? So I hope that you guys are able to join me for that presentation. And if you guys have any questions, I am always available. I know sometimes we don't ask questions on big meetings, but you can always just Teams me or email me to ask questions.
Awesome. Thank you so much, Melissa. And before we will open it up for questions here, we still have about 8, 9 minutes left in case anyone has questions. But before we do that,